welcome to Bedside Physio. I'm AJ. Today we're going to talk about lower back and sacroiliac joint pain. This pain that kind of comes around your lumbar spine, maybe down into the buttocks or the butt region a little bit. This is truly a case in point where Notorious B.I.G. was right. Mo money, mo problems. Often the result of this. When we wake up in the morning, get dressed, get ready for the day, and we go about our daily functioning, this simple piece of equipment that we all carry, or most of us carry, or you know someone that carries it, goes into our back pocket and creates a muscle imbalance and a joint stiffness issue because of this asymmetry in position. Not only is this for men or women that use a wallet, nowadays we often see this in back pockets as well. And so let me show you what happens when we use this in a back pocket and we keep it there throughout the entire day. If I take that and I put it in my pocket here, obviously the thicker the wallet, the more asymmetry it may create, but it doesn't take much to create that imbalance. When I go to sit now, my pelvis can become slightly shifted. So I get this kind of shortening, lengthening cycle that if I continually put it in the same pocket over and over again, now we're talking about potential problems in either aggravation of current back pain or limiting the gains that you're trying to make with our exercise programs that we talk about, or may create back pain when you don't have it over time. And so a few recommendations for this is one, take the wallet out when you are seated. Put it in your front pocket, set it in the console of the car, set it on your dresser or your desk, or switch pockets at least if you have to keep it in the back pocket. Occasionally take that out or take your phone out and put it in the other side. So we're not creating that consistent asymmetry, but now we can start to balance that out over time. If you can, ideally though, take it out. Couple quick exercises and kind of quick assessments that turn into exercises to look for this asymmetry, which may then create or contribute to your back pain. So let's take this wallet out for now. And from here, if you're noticing you're getting tight, specifically on one side of your back or the other, and your wallet is continually in one side of your pant pocket here, stand up from the bed or from a chair, seated position, and now with both feet on the ground, arms at your side, a quick test to see if you're asymmetrically tight is to let your arms relax, stay tall, keep both feet planted, and lean to one side. The trick to this is to not create a rotation or to start to come forward as you do this. So think of keeping nice, broad shoulders, sliding the arm down as far as you can. Normal range with this is to get just below the knee, to what we call the fibular head, this little bone just below the knee. And then you want to come back up and repeat to the other side. Again, looking to make sure you're not compensating or letting that hip and pelvis rise. If that happens, you're probably tight there. And this then immediately becomes one of your exercises. Just a nice side bend stretch. If I was tight on my right side here, I would lean to the left. You can start to add overhead movement with the arm. And all of this can complement what we talked about earlier in terms of removing that wallet from your back pocket or use a money clip or a slim profile design. The other exercise you can do for this, I'm going to show you a variation. One is coming against the wall to create a little bit of an assisted side bend movement or a lateral glide. So we often use this for other back conditions as well, but if you lean a shoulder against a wall or a door frame, walk the feet away, stay nice and stacked up, shoulders to hips, and gently just let your pelvis come into that wall to get a nice stretch. This helps to mobilize or self-mobilize your spine. And then you can obviously turn around and try the other way and see if you notice an imbalance. The progression from that is then to come onto the bed here or the floor, but this is a nice progression. Come into a lateral plank position. Feet do not have to be stacked here. Ideally, you could get them stacked. But from here now, you can let gravity and the weight of your body push that pelvis down toward the bed, get a nice stretch, and back up. Again, as we're looking to self-mobilize or create movement, we don't need to hold this up here like we do for strengthening or that muscle control. Just let the pelvis drop, come back up, and drop back down. And again, roll over, compare to the other side, and see how you feel. But truly, something as simple as removing these two things or one of these two things from your back pocket may help you better manage your back pain, feel better, move better. I hope this helps. See you in future videos.